In today's episode, we're going over, should the knees go past the toes during the squat? So this is kind of an age-old problem. You see this debated a lot. And it's funny because I've answered this several times on Ask Mike Reinhold podcast, but I'll also say that we keep getting the question over and over again. And every time I answer the question, I try to explain what knees over toes does to the knee. And I often feel like I don't fully explain as well as I would like to. So in today's episode, I'm going to go over a little bit more in depth. I also have some images that are super helpful. If you're watching this on Instagram Live, I apologize. I don't have the slides there, but you can definitely check it on YouTube later because it's going to be saved there. You can also check it on Facebook, right? So I apologize in advance for these images. I'm going to try my best to explain them, but it's going to make a lot more sense if you can actually see them. I'll probably end up just sharing them to Instagram afterwards so you can just take a look, right? I think the other problem that you'll see right now is a bit of a polarizing opinion from physical therapists and also the fitness world. I think knees over toes guy has done a great job of making knee forward exercises really popular. But I think the issue with that is that physical therapists will kind of scoff at him because if you ever treat someone that has knee pain and you try to do some of these movements, you're going to send them through the roof with pain, right? Those movements can be very, very challenging on someone's knee that has knee pain. If you have a fresh post-op meniscus repair, or if you have someone that has some sort of other pathology that's highly irritable, like these movements are like not so good, right? You have an older patient with knee arthritis, you're not throwing those movements at them. So I think we'll have a little bit of a nuanced discussion today and hopefully clear the air a little bit. And for the clinicians out there and also for the trainers out there, give you some good takeaway advice that you can use for your patients and clients right away, right? So first and foremost, is knees over toes safe? Resoundingly, yes. I really think it is safe to go knees over toes, right? As human beings, I think you can make the argument that we were designed to have our knees go over our toes, right? So if you go down the stairs, knees go over the toes. If you go into a kneeling or crouching position, the knees go over the toes, right? There's so many reasons why we need to maintain the ability of getting our knees over the toes throughout the course of our lifespan, right? I think the question you might have to ask yourself when you're dealing with a client or patient, especially if they have knee pain, is whether or not these folks are going to need to have a lot of proficiency with knees over toes, right? What do I mean by that? Well, if you're working with an Olympic weightlifter, you have to go knees over toes, right? That's their sport. If you told them not to go knees over toes, if you have an Olympic weightlifter that comes in with knee pain, and you tell them, whoa, 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 you're squatting completely wrong. You need to send those hips back more in the squat, probably going to make them worse, and or you shift the stress onto their spine, right? So you have to know that if you're telling someone not to put knees over toes, all you're doing is taking that stress and putting it somewhere else, okay? It's not like you fix the problem by telling them hips back, hips back, hips back, hips back, right? On the flip side, I think you have this, polarized opinion of everyone has to go knees over toes. Let's push it more aggressively with everyone, which I don't agree with that either, right? If you have a patient that has an irritable knee, right? It's kind of a chronic condition, flares up all the time. Do you want to strengthen the knee? Yes. But are we doing super deep squats and super deep sissy squats all the time? Probably not. It's probably going to be a little too much stress for them, and it's not worth it. It's not like they have to go into those positions every single day of their life, right? So it's nuanced, right? And then lastly, what actually happens when we go knees over toes, right? What's going on within the knee joint? There's two of them. We'll talk about both of those. And then how do I apply some of these principles to my patients and clients so you can make a change in their care right away? So before we get going, I just want to let you know about my Fitness Pain-Free Mini Course. If you like learning from me, it's the next natural step to advance your game as a coach and clinician. So there's a whole bunch of lessons I go over in the mini course. Number one is how traditional school has failed us. I love PT school, but doesn't really teach you how to be great with exercise biomechanics, progressing your strengthening and conditioning within the gym, modifying the basic lifts in the gym. We don't get a ton of that information in school. Again, I love school, but it doesn't teach you that. We'll teach you how to do some of these things. Next one is 7 reasons why people get hurt in the gym. You need to know how people get hurt to get people out of pain later and keep them pain-free for the long haul. 4 simple steps for getting folks out of pain and back in the gym, how to build the career of your dreams. Let's face it, it's great knowing how to work with folks in strength and fitness, but if you're still seeing geriatrics every single day, and that's the majority of your clientele or patients, it's not really what you want, right? So let's learn how to actually work in the population we enjoy working with. And lastly, I want to talk about the fitness pain-free certification that's actually open for enrollment right now. The fitness pain-free certification is my most in-depth course. It opens 4 times per year for 1 week enrollment period. Like I said, it's open right now. So if you want to get started, you can sign up right away. I'll put a link in the show notes, guys. You can always check out my profile. It has links to it right now. Okay. So it's basically the course and certification I wish I had, right? As a new grad physical therapist wanting to work more in strength conditioning. I'm going to teach you how to gain complete confidence working with injuries in the strength and fitness realm, learn optimal exercise technique for both health and performance for myself, as well as some of the best coaches in the world. You're basically getting a university education on how to work with injuries within the gym. Okay. So I'm going to leave a link in the show notes. I definitely recommend you guys check that out. At the very least, download the Fitness Pain Free Mini Course. And if you'd like to take that next step, the certification is the way to go. It's open for enrollment right now, but it actually closes this Sunday at midnight, and it won't open again for another 3 months. So if you want to take advantage of it, I recommend you go right now. Next, is it safe to go knees over toes? We already covered this. Yes. You have to go knees over toes every time you go down the stairs, right? If you wanted to not go knees over toes down the stairs, you probably have to go backwards or go sideways, or do something really, really wonky, and probably hurt something else in the process by trying to not go over knees over toes. It's a ridiculous thought that you're not allowed to go knees over toes. So I really believe that, yes, it's safe to go knees over toes. And yes, you have to if you're just a normal human being, right? So the next piece is it needed? So we talked about this a little bit previously, but for the average person, why do they need their knees to go over the toes? Well, going down into a squatting position, especially if it's a deep squat, going down the stairs is another one. If you're lifting something from the ground, right? Going to a kneeling position, so kind of going down onto the knees and then right back up again. Very functional position. We use that position as a human being quite frequently, okay? Now, do we need to put a lot of load onto those positions? I'm going to argue that I don't think so. Okay, for the average person, I don't think you're going to have to go knees way over the toes. You don't have to do super sissy squats. You don't have to do rock bottom squats. Okay, it's not like every single human being needs to load those positions and load them heavily. Okay, I don't think that's the case. All right. However, if you're working with an Olympic weightlifter, if you're working with a power lifter, do they need to have knees over the toes proficiency? Yes. They're not going to be good at their sport if they don't. Okay, so it behooves you to thoroughly prepare that position. Now, if you go deep squats, for the entirety of your life, or if you work manual labor for the entirety of your life, and you're in a deep, deep squat with knees way over the toes for the majority of your life, you spend a lot of time kneeling as part of your profession, is that the best for long-term knee health? I would argue probably not. We have a variety of studies that show if you compete at a very high level as an Olympic weightlifter, right? And the reason why you may get some arthritis as an elite level Olympic weightlifter might not be because the knees are over the toes. It might just because you're pushing the envelope too much, right? Same thing goes with manual laborers. They spend a ton of time in a squatting and kneeling position where the knees are way over the toes. Those folks tend to get more knee osteoarthritis that's symptomatic over the course of time, okay? I think that needs to be said. For the majority of folks, I think it's important to let them know that knees over the toes is just fine, but you can certainly overdo it. In the population I work with, it's a bunch of knuckleheads that love to go absolutely bananas with their training all the time. I think sometimes I have to pull them back and just let them know, okay, your knee is killing you. You never pull back at all. You're always pushing ahead. And there's this thought in their mind, exercise is always good, and it's not going to be a problem for their knee moving forward. And it certainly could be. So there's going to be a happy medium, all right? And the last place where I think it's relevant to start thinking about knees over toes and whether or not you need to push that is going to be, let's say, field and court sports, right? I certainly think you can make the argument for a deeper squat, let's say, or try and get the knees over the toes during single-legged training within the gym for all these sports. Obviously, jumping, you're going to need that. Cutting, you're going to need that. You're going to need that quite a bit. But the other piece is that I don't know that those folks need to go kind of ass to the grass with all their squats or all of their single leg movements, right? You simply won't find athletes in those positions too frequently, right? So a basketball player, how often do they go into end range knee flexion, right? You need to do pistol squats with those folks. You need to have every single squat they do go butt all the way to the floor. I don't think so, all right? So the reason why I say this is because you have another extreme of coaches that knees over toes is good. Everything should be knees over toes. Now, if you do too much, you can create problems. And the other part is that that's not a very specific position for their sport. So if you're training super deep squats all the time, that's not where these athletes live. They live in partial ranges. That's where they do the majority of their sports. So from a sport specificity standpoint, if you train mostly through a partial range, I think you're giving that athlete the best insurance. So they reduce the risk of injury at the knee, right? And also improve performance. Okay. Lots of research to show that parallel squat is very, very good compared to a deep squat. I know I am the guy who pushes deep squats, right? On my Instagram, you've probably seen that. However, this is a nuanced discussion. Oftentimes, a partial range is potentially better for the athletes that's in front of you. So not everyone has to go super, super deep from a performance perspective. Okay. Next thing I want to talk about is what actually happens with knees over toes. Okay. So again, if you're watching this on Instagram, I apologize. I have some really good graphics I'm sharing right now. These are up on YouTube. They're also going to be up on Facebook. And I'm going to try to share my Instagram stories so you'll see in a minute. But let me make this screen big real quick so you can see what I'm talking about. Yeah. So I want to talk a little bit about physics, right? Physics, it's boring. I, didn't pay attention very well in college. And then when I got out and I started to learn about squatting and lunging and the stress on the joints, I was like, dang, should have paid attention a little bit more. I'm going to go over the basics here I think are really important. So first, we're going to talk about moment arms. A moment arm defined is simply the length between a joint axis and the line of force acting on that joint. The longer the moment arm is, the more load will be applied to the joint axis through leverage. Okay, a lot of physics terminology. So let's look at this image right here. So in this image, I have two different types of squats. One's a barbell back squat, low bar barbell back squat, and the other is a heels elevated goblet squat. So obviously, the goblet squat, your athlete's going to be very upright. In the back squat, your athlete's going to have their torso inclined forward, hips are going to go back a little bit more, right? I have a big white line drawn through the center of me doing these movements, and that's my center of gravity, okay? Now, if you look at the amount of space between the center of gravity and the knee on my left side image, the low bar back squat, it's very small, and that's the moment arm for the knee. So does the knee work much in a low bar back squat? Yes, it does, right? However, the majority of the movement is actually going to be performed by the hips. Because if you look at the moment arm between the center of gravity of the low bar back squat and my hip, that moment arm depicted in red is actually a lot greater, okay? So if I do a low bar back squat, the majority of the weight is going to be borne by the hip. So the hip is just doing more work than the knee. This comes down to physics and it comes down to moment arms. If I contrast this to a heels elevated goblet squat, where I'm very upright, you'll see my center of gravity drawn through my body, and the moment arm from center of gravity to the hip is actually quite small. So that line in red is tiny. So the amount of work the hip does in a very upright heels elevated goblet squat is less than in a low bar back squat, okay? And that's simply because of that moment arm. However, if you look at the moment arm from the center of gravity out to the knee, depicted in green, it's a lot bigger, okay? So essentially, if I do a heels elevated goblet squat, a lot more work has to be done by the knee joint, okay? So quite simply, if I'm doing a barbell back squat, because of the moment arm of the hip does a lot more work, the knee does a lot less work in a heels elevated goblet squat because the moment arm at the knee does more work, moment arm at the hip is smaller, hip does less work, okay? And that's pretty much it. So I really, really like this image next. Again, I apologize to the folks that aren't looking at that right now. Let me see if I can make this even bigger. Let's do it. Okay. So this image right here says how changing squat variation changes knee and hip stress, right? And I have 4 different movements. On the far left, you have a barbell back squat to a box. The next movement you have is a barbell back squat. As you move further to the right, we have a front squat. And the last exercise is a heels elevated goblet squat. And if you look at the size of the moment arm for the knee on the far left, so our box squat, it's tiny. So essentially, when you're doing a box squat, there's not a ton of stress on the knee, okay? As you move further and further to the right, you'll notice the moment arm for the knee gets bigger and bigger and bigger. So a box squat, very little stress on the knee, lots of stress on the hip. A very upright heels elevated goblet squat, a lot of stress on the knee, very little stress on the hip, right? Is that making sense? So The next thing I want to talk about is anterior versus posterior weight shifts. All right. So if you have someone that's squatting and you want to make an immediate change in the amount of stress on their knee, you can tell them to bring their knees forward or send their hips back. So if they're bringing their weight forward, bringing their knees forward, taking the weight towards the front of the foot, that's an anterior weight shift and it increases stress on the knee. If we tell them to send the hips backwards, it's going to give them a posterior weight shift. So if you tell your athlete, keep the weight in your heels, send the hips back, it's going to take some of that stress and place it more on the hips. All right. So this weight shift is going to be really important. The same thing happens if you're talking about a single-legged exercise, right? And I think the easiest two exercises to explain this point would be a heel tap, right? So if you're looking at the image on the left is me performing a heel tap. That big white line is going to be that center of gravity. And you'll see how much of a moment arm there is between the hip and the knee, and the center of mass and the knee during a heel tap. It's quite big. And the center of mass between the hip and the moment arm between the hip and the center of mass is teeny tiny. It might actually be right on top of the line, right? So you can argue a heel tap is little to no stress on the hip, and the majority of the work is going to be taken up by the knee. If we contrast this to a single-legged squat, so if I sit back onto a bench, if I have a posterior weight shift onto a bench, you have a little itty-bitty moment arm for the knee and a large moment arm for the hip. So all we're doing in this situation is we're trading off stress at the knee for stress at the hip. All right. So let's change this image again. Let's talk a little bit next about different pathologies within the joint because it does get a little bit more complicated. Okay. So I'm going to talk first about the patellofemoral complex. And what does that mean? So essentially your quad, your quadricep tendon, your kneecap, your patellar tendon, right? Those structures. So which pathologies are relevant there? You have patellofemoral pain syndrome, patellar or quad tendinopathy, Osgood-Schlatter's, as well as quad strains, okay? So any pathology that affects these structures are going to be relevant. And here's the thing. The more anterior knee translation you get when you're doing a given exercise, the more stress goes onto those structures, the more pain you probably provoke in the folks that have these pathologies, okay? So what about the tibiofemoral complex? So essentially the tibiofemoral joint and all the structures that kind of lie between that, right? So we're talking about the meniscus, cartilage, also ligaments, right? Do keep in mind that ligaments they behave a bit differently, okay? It's a nuanced discussion. We're not going to go in depth on this, but I think the main area where this holds true is going to be with an ACL. So if you look at research on ACL reconstruction and stress on the reconstructed graft, the more knee you have over the toe during a given movement, like a squat, right? The more stress goes on the graft, all right? So at least for these situations, right, for these pathologies, if you go more knees over the toes, it's going to put more stress on that area, okay? So for all these conditions, more knee over the toe, more stress, okay? If you have a very irritable joint, a lot of knee forward may actually irritate that more, and it might not be a good thing, right? Kind of a no-brainer. So how do we kind of apply this information to patient care as well as kind of client training? Let me get this a little bit bigger because I can't read this whatsoever. So first and foremost, I think the big thing is that you got to meet the patient where they are, okay? So knees over toes guy, I really like the information that he gives out. I think it's very hopeful. It's very positive. We have to strengthen the knee. I think that's phenomenal. One of the reasons why PTs may scoff at guys like him is essentially because if you've ever worked with someone with a really irritated knee, you would never do any of the exercise that knees over toes guys talks about. Now, that's not fair because he has a lot of really good regressions and talks about them a lot on his YouTube channel. I would love to actually get him on the podcast at some point. I've actually reached out to him several times, but he's too big for me. If you guys know him, maybe get in his ear and tell him that I'd like to have him on the podcast. We can chat a little bit. But yeah, if you have someone who's highly irritable, you probably don't want to give them more advanced exercises simply because it's probably too much for that area, right? If I take a post-op week 4 person, have them doing, sissy squats after ACL reconstruction, I might re-tear that graft, okay? And that's a very real situation that we have to be very cautious with, okay? Post-op meniscus repair, lots of shear probably going within the joint. If you do, let's say, a very challenging deep knee flexion, knee over toe position, that's probably not going to be good for that patient. We have to be really smart about that. Even if you don't have a post-surgical patient, but they're just very irritable, if you give them an exercise with a ton of knee flexion, you might make them worse. You might irritate this even further. So it's a nuanced discussion, okay? The next piece is you're trying to bring your patient back to where they want to be. This all comes back to asking about patient goals. What do you want to get back to as a patient? If you're an Olympic lifter, you need to be able to tolerate deep knee flexion with a lot of knee forward, okay? So if you're a physical therapist telling the Olympic lifting athlete in front of you, they need to send their hips back more when they squat, you are doing them a disservice, okay? Because it's really, really tough to receive a barbell overhead, snatching, right, in a deep squat position with the hips really far back. And what you're probably doing is stretching the crap out of the shoulder, because now your athlete has to incline their torso forward to keep their hips back and keep that barbell overhead. So we need to have knees over toes with that athlete, okay? Same thing kind of goes with most powerlifters. If you're looking at a basketball player, do they need to have their knees over the toes? Yes, they certainly do, all right? But they're not going to deep degrees of knee flexion. So maybe for those athletes, we don't have to squat super deep, but we do need to ensure that knee is actually going forward over the toe when they're doing exercises. So we strengthen the athlete for the specific tasks they're trying to get back to. Jumping, right? Basketball, okay? I think lastly, we have to be kind of realistic about our expectations. For folks that have knee pain that are trying to do more in the gym, right? Or be more active. So who am I talking about? I think we've all seen that. You see a patient who has advanced knee osteoarthritis, okay? So I think this is one of those patients where we can't really push those movements that either require a lot of knee flexion, one, or a lot of anterior knee translation, two, right? Because their knees just aren't tolerating a ton of stress well, okay? Now, I'm always hopeful. I'm always trying to get my patients back to what they want to get back to. But in a situation like this, if we keep on pounding knees forward, knees forward, knees forward, knees forward, let's go deeper in those squats, push it, it's good for you, you might just end up making them feel worse, right? And if you talk to any of these folks and ask them, like, how's it feel to go down the stairs, right? It's pretty dang painful. So if we're just pushing that more and more on them, it might make them a little bit worse. So I think it's important that we just have realistic expectations for the people that are in front of us, right? If someone has some chronic pathology, hasn't gone away for years and years and years, do we want to try to push them, put some more stress on them? Yes. Can we get back to super deep squats with the knee really far forward over the course of time? Maybe, maybe not. Okay. And I think that's just kind of what you find as a physical therapist over the course of time. Not everyone's going to get back to 100%, and that's kind of okay. That's just the nature of the body. All righty. So, and the other piece too is just for, let's say if you're in the gym and you like to strength train and you think strength training is good for your body, I would agree with you 100%. I work with a population of overdoers, right? I work with a lot of Olympic weightlifters, powerlifters, CrossFit athletes, classic overdoers. And I think it's important to know that the body can only handle a finite amount of stress. If you look largely through the literature we have about athletes competed at a national, international level, so very, very good athletes, and really doesn't really depend too much on the sport. Obviously, some sports more stressful than others, but soccer, Olympic weightlifting, track and field, running. If you do too much, you increase your risk of things like osteoarthritis over the long term, okay? So I do think there's something to exercising in moderation for those folks. And again, the large majority of folks within the United States, at least, are sedentary. They need to move. Exercise is good, but there are a subset of folks that overdo it. That happens to be the majority of folks I work with. So that's one of the reasons why I say this. If you follow Fitness Pain Free, you probably work with folks that are overdoers as well. So I think there has to be a happy medium in terms of how much you throw at the knees over the course of time. All righty. So again, if you guys are just kind of tuning in, you didn't see me talk about the mini course yet. However, if you want to do that, oh my gosh, I'm making no sense. Sorry, guys. If you like what you're learning about right now, I'm going to take that next step. I recommend downloading the Fitness Pain Free mini course. I will go a little bit more in depth on some of these topics. I'm going to leave a link in the show notes so you guys can definitely check that out. Okay. So thank you very much for joining me. I always appreciate it. I Can't Dime too. Hello. Sorry I didn't respond to you earlier. I love your channel is what you said. Thank you very much. I appreciate that. I'm going to check Instagram right now. I'm going to see if you guys have any more questions before we start wrapping this up. If you have any questions you'd like to ask right now, type it into the chat and I will try to answer it before we get out of here. Let me scroll up. Boom. A lot of people joining. Thank you very much, guys. All right. Scrolling up, scrolling up, scrolling up, scrolling up. A lot of people in and out. A lot of people in and out. Good. Okie dokie. Yeah, thanks everyone for joining. I really appreciate it. Let's see. All right. I'm not seeing any questions. Let's go a little bit deeper. Good. Okay. That looks like it. All right. Well, thank you very much, guys. I really appreciate it. Thanks you for showing up and staying here to learn. I will see you guys next Friday at 10:30 a.m. Eastern Standard Time. And if you guys like this, give me a like, comment, subscribe to my channel if you aren't already. And I'll see you on the next one.